My name is Jenny Saake from StrokeOfGrace.blogspot.com. This is my daughter Princess R, and today we're going to demonstrate what my flexibility level was like before the strokes, because she's quite hypermobile and double jointed like I was. And so she's going to show you basically what my mobility level used to be like, and then I'm going to demonstrate what I'm doing for hand exercises to try and maintain and restore as much of that as possible. And I know you'll be pretty amazed at what my flexibility looks like now, but in contrast to what I've lost, I think you'll be able to see the difference. So I'm going to ask Princess R to demonstrate what I was like before, and that is not painful. It's just, it's normal for her, and it's what was normal for me. And so this is what I'm striving to regain as much as possible. So I'm going to excuse Princess R now, and I'm going to show you what I'm doing now to try and maintain as much mobility as possible in my hand. In the meantime, Princess R, can you zoom down here at my boots? These are my combat boots that I posted about other times that I just wanted to show you off today. Now we'll come back up with the camera, and every day I take my right hand to my left hand and try and work on stretching out the tendons and keeping as much flexibility in my left hand as possible. So my pinky is not really painful or terribly stiff at all, because I've just, on my own, not for therapy purposes, but I guess just as a worry factor or something, I often have played with this finger a lot since the strokes. These two fingers are pretty stiff, and you can't hear it on video, but when I get up in the morning and I stretch them, I actually hear them creaking like old leather. And I feel quite a bit of pain through the back part of my ring finger hand and down the palm of my middle finger. My pointer finger is fairly flexible and fairly usable, because I do try and use it a lot to turn pages, push buttons, grab door handles, anything like that. But my thumb is probably the finger I would lose first if I lose some mobility of my hand, because it is extremely painful and really quite stiff. I can't even grab it like this to try and move it back. All I can do is push against here, because it hurts too much to touch it in this part of the hand. So I used to be able to pull my thumb and be able to touch my wrist, and I can't even close to do that now. So when I sleep, my hand usually curls up in a tight fist, and I wake up and have to straighten it out again. At this point, I'm thankful that I can continue with mobility. When I'm not paying attention to what I'm doing, it's usually carried around like this. And I catch myself often and have to intentionally relax the grasp on my hand and try and straighten my arm back up. Every day I try to go through the sign language alphabet, and I used to be able to do that pretty in sync with both hands. Now I use my right hand as my model, and I try and mirror what I'm doing with my left hand. So I go through each letter that way. And I have some success better with certain letters better than with others. But I used to be able to do this quite quickly and in sync with both hands, and now I can't. So that's something I'm trying to regain by therapy, is to improve my sign language skills with my left hand. So thank you, and have a great day.